Hello, hello, everyone. Wherever you are coming from, hello, we want to welcome you. We're going to give ourselves just a few more minutes. If you'd like, you can go ahead and begin putting in the chat your name and your organization and where you are based, just to let us all know where and in what capacity you are working. That would be great. Go ahead and use the chat to do that. We're going to get started in about 2 or 3 more minutes. Thank you so much.
Good morning, good afternoon all. We'll get started momentarily. Good to see so many familiar faces and some new folks in the room.
Okay, we're just going to give it a few more seconds and then we'll get started. Again, thank you for those who are putting your name and your organization and location in the chat just to share with us where you're coming from. Thank you so much. Go ahead and continue to do that for about 30 more seconds before we get started. All right, we're going to go ahead and get started. We know there are some who are still joining us, but we have a lot of material and guests that we'd like to make sure we have time for and time for discussion as well. So I'm going to go ahead and just say good morning, good afternoon, good evening to everyone who's able to join us today. I want to welcome you to the WASH and Healthcare Facilities Community of Practice Initiative event. We're so very glad that you can join us today for a session entitled Building Climate Resiliency into WASH and Healthcare Facilities Programming. I want to introduce myself and our team. I am Joanne McGriff, Assistant Professor within the Department of Global Health within the Rollins School of Public Health at Emory University, as well as core faculty within the Center for Global Safe WASH at Emory. I have with me Haley Elling from World Vision, as well as Lindsay Denny from UNICEF New York. We also have several members of our Community of Practice Steering Committee members present in the virtual audience. These are the good people who provide guidance and input into the conceptualization as well as implementation of these sessions, including one of our steering committee members who's going to be serving as one of our presenters for today. So we do welcome and again thank Hadra Mukasa from Amref Health Africa. We're also very fortunate to welcome several other speakers from a number of other organizations like Ale Israel Lajun, who is an architect from the Health District of Coban, Guatemala. We have Prakash Bohara, who is from Terra de Om in Nepal, and then Steve Sara from Save the Children US. We are excited to have these speakers gather to address a very important and often challenging issue of building climate resiliency in healthcare facilities in resource-limited settings. We have the opportunity to hear a variety of perspectives from the district level, facility level, and even some discussion on resource mobilization. So this is a jam-packed session, and so we hope you're able to stay, and then if you cannot, please view the video, but share the information that you received from this session. Again, if you are needing to leave early or can't stay on for the entire 90 minutes, please refer to our YouTube channel or go to our webpage to view the video, and hopefully we can put where our webpage is in the chat. So next slide, please. We also have with us a great team of interpreters who are going to assist us today with Spanish and French-speaking participants. In fact, I'm going to ask you to go ahead and choose your language of choice in the bottom toolbar. We're asking our participants listening in English to also please choose English today, because one of our speakers will deliver their presentation in Spanish as their primary language. So we just want to make sure everyone has their chosen and preferred language in Zoom to allow for easy transition. Next slide. Before we launch into our session, as I always do, I want to take a few moments to just welcome new participants to the community of practice and tell you a bit about what we do and who we are. So we are an action-oriented learning platform that brings together the WASH and health communities to focus on policy, evidence, and practice in WASH and healthcare facilities. Our goal is to connect the expertise and experience of our partners and colleagues to the members of the WASH and health community who've expressed interest in taking action in WASH and healthcare facilities. We've created this platform as well as our newsletter and webpage to share resources with the WASH and health community. And with every session, our goal is that participants walk away with some tangible information that will allow you or them to take the most immediate steps to advance the improvement of WASH and healthcare facilities. Next slide. I also want to remind you and everyone of the guiding principles of this COP so that you know where we're coming from in terms of these webinars and in terms of how we think about some of the topics that we share with you. So first, WASH is a fundamental prerequisite for quality care within a healthcare facility. We believe that there can be no effective infection prevention and control without adequate WASH. We also believe that WASH in healthcare facilities and the challenges that we all are aware of is a solvable issue, but it will require multiple systems, sectors, and stakeholders to work together to see sustainable improvements. And then lastly, the community of practice is open to all who seek to learn and share about WASH in healthcare facilities. We welcome all and respect the diversity of the perspectives of those who are here to share information with us. So whether you are a seasoned expert in WASH and healthcare facility or someone for whom this topic is new, we welcome you and we appreciate your participation. So next slide. So each time we get together, we want to make sure that we're providing you with the latest in terms of updates in WASH and healthcare facility. For this session, we want to make sure that many of you who may be aware of the WASH Fit portal, I don't know if we can put that also in the chat. This is a resource where you can find the training manuals, the guides, all kinds of additional guidance documents as it relates to implementation of WASH Fit, understanding what WASH Fit is. Well, as of last month, when you go onto the website, you'll see that the WASH Fit material is now available in French, Spanish, and Russian. So please, if you have partners and others who are have not been able to access these materials in these languages, make sure they go over to the WASH Fit portal and take advantage of these new translated resources. And so, next slide. The next component of our session is every time we get together, we want to make sure we're sharing some good news. So positive things that are happening in Washington healthcare facilities. And today, with the help of one of our guest speakers, Steve Sarra from Save the Children, we're going to be sharing some good news that's happening in the government of Niger. So I'm going to pass it over to Steve.
Thanks, Joanne. Hi, everyone. I'll be fairly brief. My team at Save the Children, along with colleagues from supplies, materials, equipment for infection prevention that should be at every healthcare setting. So we published this list to complement sort of WHO's list of essential medicines, which provides similar guidance for medicines and has been long relied upon. Once we did that through the Momentum Country and Global Leadership Project, my team took the list and through another project, USAID Kulawa in Niger, we started advocating with the Ministry of Health in Niger to adopt the list. So we went through a series of workshops with them and other stakeholders to adapt the list and then adopt it. And it was formally adopted by the Ministry of Health in March of this year. Our team is now supporting them to roll out the policy. We're planning to do supply chain bottleneck and costing assessments with them to help them roll it out. And we're also continuing advocacy with other countries and private and faith-based health networks to adopt and apply the list. And we're also starting to look at national stock management systems and compare the list to those systems to see if all the supplies are included, and if they're not, to try to get them in there. So this is just one aspect of the infection prevention problem that we face around the world, but we're hoping that we can make some progress on these basic infection prevention supplies like soap, gloves that are needed to maintain a good, safe, clean environment in the health facilities. That's all for me. Thanks, Joanne.
Great, thank you so much, Steve. Again, this is really a great success as we feature different stories within the community. This one's really nice because we're seeing it at the government level. And so it's really very positive to hear this, and hopefully you can keep us updated as more comes out of Niger. So moving on to the next slide. We just wanted to give everyone an overview of today's agenda. This is just in case some may need to leave after the first hour or before then. So this is what we plan to cover. There's going to be an overview presentation on climate resilient WASH and healthcare facilities by Lindsay Denny, who's part of our learning team. We'll then showcase two case studies, one from MREF Health Africa, Uganda by Comfort Hadra Mukasa, and then a second case study from Terre-des-Hommes in Nepal by Prakash Bahara. And then we have the opportunity to hear from Steve Sarra again, who you just heard from, who will share components and insights after developing a large proposal for major climate resiliency work in healthcare facilities in Lao PDR. This proposal was received or has received initial approval of the concept note and is now pending further review by the Green Climate Fund. So for those of you who are interested in resource mobilization for climate work, this last segment will hopefully provide some initial set of guidance and give you an opportunity to think through some of the aspects that really make for a strong application. And then I think in the chat, we're including part of the proposal, at least the concept note, that is publicly available. So those of you who can, please go ahead and download that so you can follow along as Steve provides some insights from that process. So now without further delay, I'm going to hand this off to Lindsay Denny, who's going to give us that overview of climate resilient WASH and healthcare facilities in general. Thank you so much. Lindsay, over to you.
Thank you so much, Joanne. And as you said, I'm Lindsay Denny, and I am a consultant for UNICEF headquarters. And I particularly focus on safe and sustainable healthcare infrastructure, which includes climate resiliency. So today we're going to focus on climate resilient WASH and healthcare facilities. But before we dive into that narrow topic, I want to take a step out, zoom out a bit, and look at climate resilient healthcare facilities more broadly. So in 2020, WHO published guidance on climate resilient, environmentally sustainable healthcare facilities. And they provided a definition, which says that these facilities anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stresses, while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it. That's a long definition, I realize, as is the name climate resilient, environmentally sustainable healthcare facilities. Try saying that 10 times fast. But let's break this down and talk about what it means practically. So there's two sides to this. When we look at climate resiliency, we're looking at facility designs that are risk informed, such that the healthcare facility can continue to provide service with minimal disruption, despite any kind of climate related impacts or events. This could be extreme flooding, drought, etc. The other side of the coin is environmental sustainability. This is when we think of greening healthcare facilities, for example. This is so that the healthcare facility operations do not further exacerbate climate change, such as the burning of healthcare waste. And when we talked to our steering committee about putting together this session, we agreed that we wanted to focus first on the climate resiliency angle and talk about building up the resiliency of the facilities where many of us work, and not today focus on the environmental sustainability piece. But I want to mention it because they're often linked together when we talk about this topic. So what are these climate related risks that we should be concerned about? This diagram also comes from a WHO guidance document looking at assessing vulnerabilities in the context of climate change. But we understand that climate change is going to impact risks that then impact the resiliency of the healthcare facility. So the risks are made up of three specific components: hazards, vulnerabilities, and exposures. Hazards are these weather-related events that may be exacerbated by climate change, so extreme flooding, droughts, sea level rise, frequent storms like hurricanes, etc. The vulnerabilities are the unique elements of the healthcare facility. So this might be the social, demographic, environmental components of the facility. And then lastly, the exposures include things like the water, the sanitation, and the waste that could be impacted by these climate events. So in all, what we want to do is try and build up the resiliency so that these hazards don't cause an impact in service delivery, right? And I think this image is actually quite helpful to think about this, and I'll talk us through it here. But if you think about the capacity of the healthcare facility and its delivering of care, you have this normal line here, and then either a stress or a shock will decrease the performance of the healthcare facility. How much it's decreased is really dependent upon the risk. And again, that risk is defined by exposure, hazard, and vulnerabilities. So that unique combination will determine how the performance recovers after that acute or prolonged climate event. So ideally, at the very least, the healthcare facility recovers to pre-event state. In an even better situation, the facility recovers then better than before, or it is transformed. And that's really what we're talking about when we say a resilient healthcare facility. I think sometimes we use the phrase build back better as another example here of really building up these healthcare facilities where perhaps infrastructure did not exist in the beginning. But more often than not, what we see is that the facilities recover, but they're worse off than before, or in the absolute worst case scenario, there is an utter collapse. So what I think is helpful for us to think about here, if we're trying to minimize the amount of response and recovery time to bring facilities back up to full functioning in order to deliver safe healthcare services. And in particular, keeping in mind that a climate-related event may cause a greater demand for healthcare services. The guidance document I referenced at the start, the Climate Resilient Environmentally Sustainable Health Facilities Guidance Document, outlines 4 key components of a healthcare facility as it relates to building resiliency: health workforce, wash and waste, energy, and then this kind of catch-all element of infrastructure, technologies, and products. The reason I emphasize this is to realize that wash is not just a passing sentence in this document, but it actually makes up a quarter of the chapters. It's a really large component to how we talk about healthcare facility resiliency. Thus, for those of us who are not necessarily coming from this space, important for you to understand that there is a large space for you at the table, and there is a lot that you can contribute to this conversation and also interact with those who are looking at other elements of resiliency and environmental sustainability within the healthcare facility. The guidance document provides an intervention process. And if you worked in Washington healthcare facilities, lucky you, this process should look familiar. In fact, it's identical to what is in WashFit. So you assemble and train a team, you establish a baseline through an assessment, you define and prioritize interventions, you then implement those interventions, and lastly, you monitor and evaluate your improvements. So the reason I raise this is because I realize I'm bringing up a whole new guidance document for you, but I hope that you can see that actually there is synergies between these. And in fact, when I talk about WashFit later on, you'll see that they've spent a great deal of time trying to integrate much of this. So it's not asking you to use a whole separate tool, a whole separate guidance document. It's actually already, the work has been done for you, the integration has happened. I just want you all to understand where that came from. This isn't just random climate questions that were integrated, but in fact, it comes from a set of guidance documents that outline a broader approach to climate resiliency in healthcare facilities. Coming from the other side, of course, the WASH sector is simultaneously thinking about climate resilient development. And there is a number of documents. One example here comes from UNICEF and Global Water Partnership, among other partners, talking about climate resilient development. It goes through things like the various hazards that you may need to be concerned about, and then their impact on the WASH sector. Certainly drought and the kind of interventions you can take to address this. Doesn't matter whether you're in a healthcare facility or a community, it's going to be similar types of WASH interventions perhaps. The system and the users are different, and that's what we need to keep in mind. But I think it's helpful to see that there is some good information here available from those who want more of a WASH perspective. So bringing it all together, let's talk about climate resilient Washington healthcare facilities interventions. If there's one thing to take home from today, it's that there is no one size fits all model for climate resilient Washington healthcare facilities or climate resilient programming writ large. Instead, you're really going to need a tailored plan because it's based on these identified risks, which are shaped by vulnerabilities, exposures, and hazards. And that's going to be different for every healthcare facility. It may be something you can kind of adjust within a district because they may be similarly affected by a certain hazard, but the size of the healthcare facility, the type of services in place are certainly going to differ. So you really need a tailored plan that takes these into consideration. But once you've identified the risks through that process, the 5-step process, you can think about what specific interventions might be appropriate. And here's a list of examples. It's not exhaustive, but for example, water quantities. If we know that there is insufficient water throughout the year, then looking for an alternative water source, increasing water storage capacity, or connecting the source within the wards and repairing those leaky pipes and taps are types of interventions you can take to improve the resiliency of the wash and water services within the healthcare facility. For sanitation, wanting to ensure that the health facilities have raised toilets can help prevent overflowing during flooding, or using low flush on-site systems if the healthcare facility doesn't have sufficient water services in order to maintain a clean and hygienic sanitation facility. Hand hygiene is going to be linked back to the water access and water availability, but there's also behavior change that you can take to promote reduced use of water, for example, when hand washing. So again, these are all examples of the types of things that you could use. And one great place to look into more of these types of interventions and understand how to implement it is WashFit 2.0. You may be familiar that in April of 2022, we released an updated version of WashFit, and there was considerable effort to ensure that climate was integrated, not just through working with climate experts, but as I mentioned, also integrating that guidance document from 2020 on climate resilient, environmentally sustainable healthcare facilities. So there's a technical fact sheet that talks you through each of the activities in WASH Fit and how you can look at it from a climate resilient lens, what type of activities or additional considerations you need. There's also the assessment tool for WASH Fit, which many of you I'm sure are familiar with. There are questions integrated directly from the climate resilient document from WHO into WASH Fit. So again, you don't need to do a whole nother assessment. Much of it is here. It may be valuable to peruse the other documents and understand what's there, but there's really a lot of integration already taking place. There are also training modules on climate resilient WASH and healthcare facilities. So there's this can be supportive of training people on the actual tool, but also helpful to help train staff on the type of interventions and things to think about when doing the implementation phase. So I highly recommend downloading WASHFit 2.0, downloading the climate resilient, the technical fact sheet, as well as the module, and using that as resources to guide you in this process. Last but not least, while we've talked much about the interventions, we don't want to overlook the policies, the guidelines, the monitoring systems. Often, I think we use the phrase climate resilient in passing like a buzzword, but there isn't much meat beyond that. There isn't much substance. So when we think about climate resilient WASH and healthcare facilities, I think it's critical that we evaluate our policies and our guidelines to ensure that climate resiliency is really integrated more from a substantive perspective, and making sure there is clear recommendations on what that looks like in this country, despite the fact that at the end of the day, it really comes down to a tailored plan. And similarly, monitoring systems, trying to build that more robustly in. I know that's a difficult piece, and we're not going to talk about it too much today. Certainly something for the community to talk about in the future. But I will leave it there and hand back to Joanne. I think that helps give a quick primer and then gives us space to talk about our case studies, understanding the various tools and resources that are available for this. So Joanne, back to you.
Great, thank you so much, Linda. And actually, it was a great primer. It's really informative, just showing us all the different approaches, the standards, the tools, and now even examples of policy and guidelines that are out there. So thank you so much for that. Before we transition to our next speaker, we do have a quick poll that we'd like to have with this group, just so that we can get a sense of who is with us today. Have a couple of quick questions. So if someone can just launch that poll for us.
It's open, Joanne.
I was gonna say you should be able to see it. Hopefully.
Okay. All right. So hopefully we see the first questions. Are you aware of policy or guidelines related to the climate resilient WASH and healthcare facilities in the locations where you work? So give us an answer there. And then, are you engaging in climate resilient WASH and healthcare facility efforts? And then, what do you need to better implement climate resilient programming? So if you can just take a few moments and complete that poll, that would be great. Thank you.
Take another 20 or 30 seconds to answer these questions, folks. All right. I will go ahead and give you the last 10 seconds. I need the little buzzer. Do, 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 do. Great. All right, let's go ahead and end the poll, and I will share the results. All right. So it looks like about half and half, 50% of you are aware of climate resilient guidance in your country, the countries and locations where you work, and about half of you are not. So something certainly for all of us to go back and think about upon return from this to see if they do exist. And similarly, a number of you are currently engaging or plan to engage. So probably 90% are either going from full implementation or planning to begin implementation in the next year or so. And a few of us don't currently have plans to do climate resilient programming. Maybe we can change your mind over the course of the next hour. And last but not least, well, this is great to hear. The type of support needed to better implement climate resilient programming really varies. So policies and guidelines is the top top request, but also technical support, financial resources, monitoring indicators, and case study examples. Apologies, it looks like I made that a single choice question rather than multiple choice. I'm sure you all probably felt like you needed a few things here, but I guess we'll say this is the top thing you feel like is needed. So we'll keep that with us. Joanne, I'm going to pass back to you.
Great. Thank you so much, Lindsay. And thank you for all of you who put comments into the poll. If some of you would like, please go ahead to use the chat box if you want to make more comments or just continue to answer if you did not get a chance to do it before the poll closed. But again, we just really would like to hear from you. So again, thanks for those who completed it. So I'm going to transition now to our first speaker with us, who we have, Alain Israel Lajoun, who is an architect from the Health District of Coban in Guatemala, who's going to speak with us about a district level perspective as it relates to climate resiliency of WASH and healthcare facilities. So I'm going to now pass it over to Arquitecto Alain. Please go ahead.
Gracias. Muy buenos días a todos.
Thank you and good morning to all. Thanks for giving me the opportunity to be in this space. From a perspective of climate resiliency in my country, Guatemala, the situation is quite complex because the district that I supervise has an extensive policy of health facilities. And we are working on policies to respond to events. In our country, we are affected by tropical storms that bring intense droughts, mudslides, rivers go off, and we, in occasions, also have to deal with fires, forest fires. Unfortunately, we have a limited budget, and with the extensive network of healthcare facilities, it's very difficult to have an immediate response. We had ETA hurricane, which recently hit Guatemala as a storm, and one of the most affected states in Guatemala was ours. In La Paz, we have 3 municipalities that were greatly affected by floods, and many of the health facilities were completely ruined. And the response was rather slow. As much as possible, we have received assistance from UPS and the health cluster. Also, we had humanitarian response by UNICEF. And thanks to them, we were able to develop some projects to recover and replace the health facilities that were damaged. But the response was limited due to a lack of resources. I don't know if anybody has a question or any comments along the lines of what I have just shared with you.
Thank you, Alain. Does anyone have questions? We have time for about one. If you would place it in the chat or raise your hand so that we can see you. And hopefully I'm not seeing anyone in the chat right now. Okay, well, thank you very much, Alain Israel Lajoun from Guatemala. Thank you for sharing your perspective. Please continue to join us so that as the session continues, if there are more insights that you would like to provide, we'd love to hear from you, again, considering your perspective. Do we have a question?
We do have one question that perhaps Architect Alan would be willing to answer.
Okay.
What climate resilient solutions have you implemented in Guatemala?
Realmente, pues, políticas existen, ¿verdad?
Well, we do have policies that already exist, but basically it's been identifying the risks and trying to locate new constructions outside of risk locations. However, due to the geographic location of our country, this is complicated. The topography in my country has many hills and mountains. So it's complicated not to have risk zones. Most of the areas are highly populated, so there's very few spaces for new developments. So it's very difficult to find an ideal place for development and building. There's always risks that are assessed, and we try to have adequate construction with the appropriate measures.
Thank you so much. Again, we appreciate your perspective on this, Architect Alain. And just in the interest of time, we're going to go ahead and shift over to our other speakers. Thank you so very much for your contributions.
Gracias, es un gusto.
Thank
Okay.
you, and it was a pleasure.
Thank you. So now we're going to shift over to one of our case studies that we mentioned, and this is from AMREF Health Africa in Uganda. We're going to have actually one of our steering committee members who's going to share with us, Comfort Hajra Mukasa, about some of the work that's being done with AMREF. So Hajra, if you are there with us, please go ahead.
Thank you very much. Greetings of the day to everyone from wherever you are. Special greetings to Peter Pwanya, Ellen Walter, longtime friends. I think in the interest of time, I may not go through these first slides. We could scroll to slide number 25. In the meantime, as I tell you, my name is Comfort Hajra Mukasa. I work for AMREF Health Africa in Uganda. I manage climate change, neglected tropical diseases, and I manage water, sanitation, and hygiene. As a bit of background, AMREF has been integrating WASH in healthcare facilities for purposes of increasing uptake of maternal reproductive child and adolescent health services. So our journey of WASH in healthcare facilities started in 2016. But over the years, of course, there were guidelines that came up, like specifically the WASH Fit. And we use the WASH Fit a lot, especially to assemble ourselves, assess the problem, but also purposely for bringing together stakeholders. So in this particular case, our interest has been so much in Northern Uganda because of the historical issues of Northern Uganda, especially the Acholi region, a region that has battled with post-insurgency issues for the past 20 years. And so our desire was that as we improve water, sanitation, and hygiene conditions in communities, we don't leave out the healthcare facilities. And as we improve these conditions in the healthcare facilities, we don't leave out the communities. Otherwise, there's going to be scrambling for the limited services and there will be no shared responsibility. And so our model is to always pump water to an institution, the healthcare facility or the school as the point of learning and sharing knowledge, but then also extend this water to the communities and have them take care of their own water sources, but also the water at the healthcare facilities. We registered success in 6 healthcare facilities, particularly in Namuru, but when we went to another district called Pader, we hit a snag. Mostly we found very interesting challenges. And so we had challenges of dry wells, and when we tried the swamps were also dry. So we needed to do something, and the alternative water sources were really far. So we held community dialogues with the communities. We brought on board people from the district, community, elders to assess what the actual problem was. Next slide. I'll turn off my video. And so for this, as we had these discussions and we're doing our root cause analysis, and when I say root cause analysis, it's not like the workshop root cause analysis method of doing work. It's having conversations with communities and trying to find out, because one thing we know is that the word climate change does not make sense to these people. For them, what matters is that the wells are now drying. We no longer have rainy seasons as we used to have them. And so then the issue of climate change does not really, they only feel the effect of climate change, though they do not know what really happens in these spaces. But then when we had conversations with the healthcare facilities, we identified certain risks. And like I said, one of the key risks was the drying of even the deep wells, then increasing water wash disease conditions, particularly trachoma. And trachoma is a neglected tropical disease in Uganda. Then we had issues of flash floods. And 2 years ago, one of the staff that we work with in partnership got washed away by flash floods, and this person died. You know, an area where there were normally no floods, a road, then all of a sudden there's a flash flood. And then there was increase in waterborne diseases, mostly because each time it would flood, the toilets would be washed away, and then this mingles up with the water that people use for domestic use. So we developed action plans with the communities to resolve this water problem. So for the community, their interest was solving a water problem. But then solving this water problem was to address the issues of climate change. And so we also needed to ask the donor to give us a budget neutral extension period, because one learning we have come to realize and appreciate is that issues of climate change cannot be solved in a project of 2-3 years. The climate change damage takes a long period to happen. And so climate change mitigation adaptation should be allowed ample time. And there should be, the donors need to understand that budgets allocated to climate change should be flexible, so that budgets are allocated and reallocated as and when need arises. So that when in the event we wanted to do adaptation, but then we realize what is urgent for now is mitigation, there should be flexibility from donors and in terms of budgeting and time allocation. And next, please. So the community dialogue. So, and then what we did is we identified solutions. So the community missed a swamp. There was a key swamp that was served by streams from River Aswa, but also this swamp was not just a swamp, but was also a source of food for people where they would get fish. So we agreed that we had to recover our swamp. So as we are recovering the swamp, we are doing climate change mitigations, but for them it's recovery of their swamp. So we had needed to cover such a key resource for the community. And then we together agreed that moving forward, even when we recover the swamp, we're going to do swamp-friendly farming like sais or papyrus growing. Then communities recommended that we have mandatory terracing for their gardens and earth banking, like using earth banks to make sure the flow of water down hills is reduced, the speed is reduced so that it allows ample time for water to be soaked into the soils and recharge aquifers. Then we came up with the idea of joint sponge communities, where communities dig holes around their home states to allow for water to soak, and we call that sponge communities. But also we needed to have advocacy to bridge the gap, because some of the things we wanted to do, like provide bridges, we didn't have money for that. But we knew if we involve the district stakeholders from the beginning, we would get some of the tools like tractors to use. And then we developed simple indicators to use to track and see what would happen. But then our meeting point was always the healthcare facility. There's nothing that is such a turnoff than a sick person going to a healthcare facility and they can't access water. So that turnoff was also motivation enough for communities to want to do something to make sure there's water at the healthcare facility. Next. So we got some results. When we did all that we did, the sponge, the earth banking, the swamps are not recharged immediately. After the first rain season, there was no recharge. But the district had helped us to create a bridge that was connecting one side of the swamp to another. So after 2 rain seasons, the swamp got recharged. We also had a shallow well that people were so sure had just dried up because of water. And so after 3 rain seasons, that's like a year and a half, the shallow well recharge. But then what excited the community was the aquatic life, regaining aquatic life in the swamp, like the mudfish and the catfish. And then also the bridge that we got from the district made access to these communities better. Then we're also now able to pump water to these 2 healthcare facilities. Though we did not do big tanks, we just did an 8,000 liter reservoir that pumps water to the healthcare facility and 6 adjoining communities, nearby communities, a host community. But then also in the process, we all appreciated the importance of conserving the swamp as opposed to using the swamp for the time that it can serve you. And this community jealously guards their swamp because they've lost it before, they don't want to lose it now. But we also came up with other climate smart solutions like building simple fossil tunnel toilets that are very cheap. And though these are called ecological sanitation options. Next. So what we want to do is to scale these approaches to other AMREF project areas, but we also want to build capacity of local government staff, especially the environmental health staff, and in the process, help put up like plans. Right now, nationally, we're trying to come up with the Health National Adaptation Plan for climate change, but we also want to come up with district-specific national adaptation plan, but for sanitation. And this is where we are looking at recovery, adaptation, and mitigation. We want to integrate climate change in all our implementation, but also safely managed sanitation facilities is what we are promoting now. Though our partnership with UNICEF, we also promote the basic, but our interest is safely managed. But for the purpose of making sure no one is left behind, we also allow the basic to happen. Then we now use bulk water point supply as opposed to point source. But then, and as much as government has got critical requirements for water, like paying the community capital cost contribution, for us, our critical requirement is that you need to plant trees around the catchment if you want us to connect you to water. And then we have climate change sensitive programming as key. We actually have a strategic objective in our AMREF global strategy. If you went to our website and clicked on our global strategy, you'll find that climate change and its intersectionality with health has become a key drive for us as AMREF. But we know that we need to continue advocating for integration of climate change programming on all local governments that we work in. And we need to focus on system planning versus single point planning. Because one thing we discovered, there are very many resource options in districts, but what happens is that everyone is doing things, planning, having their own plans, so that even the simple resources that we have get lost. Next. But we know we need more funding. If you've been to Agago and Pader, you realize that the challenges are also catalyzed by some of the places being so rocky. So some of these rocky areas need more funding in the face of climate change to come up with the most appropriate solutions. But we also need to integrate community and facility water access meaningfully. But this requires huge investments in bulk supply. But then we also, water without sanitation in the face of climate change makes the situation worse. So as we're promoting water access, we need to support communities, and this could involve, what we are looking at is revising the policy of zero subsidy for household sanitation to come up with selective subsidies so that we can help people at the bottom of the pyramid, at least to take care of their substructure and have the safely managed substructure. Then last but not least, next slide. Then lastly, we want our recommendation is that it's very important to involve the front bearers of climate change, that is the women, in programming, so that the indigenous solutions that they are used to become a foundation for new solutions. Otherwise, I mean, we are the ones who are supposed to implement these solutions, they won't make sense to us as women. And since we have youth making over 7% of the population, unless we make interventions attractive to them, maybe thinking digital, then we are speaking to the elder people, but then the 70% of the population, these things will not make sense to them unless we make it make sense to them. Then holistic system thinking and planning for leverage. Unless we go system thinking, system connection, we are going to waste a lot of time and a lot of resources, but we'll never realize meaningful integration. I thank you, but I remain Comfort Mukasa.
Thank you, Comfort. That was an excellent presentation. And I see in the chat, you have many comments and questions. And so we're going to hold those just for a few more moments because we'd like to turn to our second case study, But what I really want to comment on is I really appreciate you going step by step into your process on the ground and how the climate resiliency work really came from community-derived solutions and just working together. That was really very good to hear that and to hear all the different ways that you work through the different challenges. You know, a bit different than what we heard from Arquitecto Alan, who is thinking about the planning and the development pieces within a dense space. So I think this is a really nice way to sort of bring together all the different and unique pieces as we're thinking through climate resiliency. So thank you for your wonderful presentation, Comfort. And so now we're going to turn over to our second case study, and this is right before we go to Q&A. So if you have more questions related to anything we've talked about thus far, please go ahead and start putting them in the chat, because right after this next presentation, we're going to go into Q&A. And so I'd like to introduce in this next session, Prakash Bahara from Terry-de-Om, Nepal, who's also going to talk with us about, again, their work and perspective on climate resiliency in healthcare facilities. So over to you, Prakash.
Thanks, Jenny. So in my presentation, basically, I'll be sharing the Nepal experiences, how we are building climate resiliency into WASH in healthcare facilities. So next slide, please. Okay. So starting with the WASH pit, because TDS in Nepal, basically Ministry of Health and Population, they have endorsed WASH pit in 2017-18. So we are in the process of actually the ministry is in the process of updating WASH pit in line with WASH pit 2. So we're basically the transitioning. And TDH Terre-des-Hommes is one of the kind of leading organization in Nepal who is implementing WASH fit. So all our intervention in SCF, they are guided by WASH fit. So you could see some photographs and some outcome of this WASH fit assessment year, WASH fit report, and then WASH fit assessment, WASH fit report, and then WASH improvement plan. Next slide, please. So, I mean, the area that we're working is, you could see the red circle area, which is one of the highly flood prone area in Nepal, which I think it was, this is, I think the recent one, I think 2-3 years back. So, so our project location site is one of the highly flood prone area. And we sometimes mostly struggle with this flooding thing. So we have in my next slide, I'll be sharing some of the intervention, how we are coping with this this flooding to improve our washing healthcare facility. I think this is something what Lindsay already highlighted on. So I will not go through in detail, like it basically highlighting that what are the impact of climate, like particularly flooding on WASH in healthcare facilities. So I mean, I have highlighted 3 or 4 points here. So basically disruption of water treatment infrastructure, sedimentation, contamination, and pathogen and disease. So I'll not go into detail. So next slide, please. Okay, here I'll be sharing some of the effort that towards climate resilient WASH in healthcare facility, keeping in mind the flooding in the project location. So in the next slide, I'll be sharing some intervention adopted by the project following the WASH pit, and when we have some learning as well. Next slide, please. So this is basically the water treatment system in healthcare facility. You could see that we have installed water treatment system at the first floor of the healthcare facility, and you could see the left hand side that we have water tap which is raised. So so that the facility or patient, they can collect water from there, which is, I think, in case of flooding as well, that they have access to. We have ensured that the health facility and the patient, they have access to safe water. Next one. And this is also the similar one. So we have sufficient storage capacity as well. And these water treatment system are connected with the healthcare facility as well. So there are some of the intervention actually in terms of so to deal with climate flooding, we have ensured that the healthcare facility and patient, they have access to the safe water services. Next one. So these are other example where I mean, this is something that we have put in place, that there's a schedule that healthcare facility, they emptying the septic tank, and prior to the, I mean, there is a kind of the season, like this May June to September, there's a rainy season in Nepal, so there's a high chance of flooding. So so we actually worked with the healthcare facility that they, to ensure that the septic tank are regularly being emptied during this period, and the construction of toilet in the location within the healthcare facility, either they are raised toilet, or within the healthcare facility, they need to, I mean, we identify the space where they have less prone to floods. And third one is particularly a distance between the toilet and the water sources. So this is some intervention that we are doing. Besides that, regular cleaning of toilet is also kind of very important in this kind of situation. Next one. These are other interventions, like promotion of non-borne technologies that we are promoting. And left hand side, you could see that some of the intervention we whatever we do, you know, I mean, we have mostly in a healthcare facility in Nepal that the open burning is widespread actually. So I mean, during flooding, I mean, we can imagine that how it can affect the entire the healthcare facility. So these are some interventions that we have been basically supporting to the government, the healthcare facility or local government, to improve this kind of to have this kind of infrastructure, so that there's a minimum effect of flooding. Next one, please. Okay. So I mean, as I mentioned earlier, the flooding is the main hazard in our project location. And the another challenge we have in Nepal is there is no guiding instrument to promote climate resilience infrastructure for washing SCF. Definitely, we have global document. There are some agencies what using them. But we do not have the context speak like a guideline that is very much address the need of the country, you know, like there are different type of water supply system, the sanitation facilities. So this is something that we are lacking. There is one actually which is basically focusing on, which is developed in 2017, but this is something related to the rural water supply system, but we don't have that actually for the country. So this is something we really feel that this is one of the challenge, and hopefully that we will have this in future. Second one is in educate or untrained health workers. So this is I think one of the challenge that we see everywhere actually. So this is something I think need to be focused actually. And then since Nepal is in the new federal structure, I mean federal system. So at the moment, the another thing that we're struggling in the country is we have a local government which is very powerful, but we do not have a dedicated wash unit within the local government. So there is no dedicated person to look after wash in healthcare facility or wash related issue. So I think this is also kind of one of the challenge, that there's a kind of lack of focus from the local government. And another is the cost for the power backup installation. So when we say solar, I mean, which is pretty costly in case of primary healthcare facilities. And also this is something I think is covered by the previous presenter as well, is not strongly integrated in the existing programming by the local government, which I think one of the challenge for Nepal as well. Next one, please. So there are some opportunities actually in Nepal. So as I mentioned earlier, so we are updating WASFIT 2. So this will allow us to have more climate resilient indicator in WASFIT 2. So this is something which I think we're working together with the ministry, together with UNICEF, WHO, the other agencies as well. So we have that opportunity in the country. So second one is this development of operation and maintenance policy. I think what we all have agreed is that regular maintenance of water sanitation and hygiene facility could have minimum disruption that can help us to have minimum disruption of wash infrastructure during flood. So I think if we have such kind of policies and fund allocation on the basis of these policies, and that will help us to maintain the wash facilities, wash infrastructure, and during flood, I think we'll have minimum disruption of wash infrastructure. So, I mean, fortunately, we managed to have this kind of this model policy that you, unfortunately, I mean, sorry, this is in Nepali. So this is something what we have supported to one of the municipality. So they have recently allocated some, I mean, a good amount of money to a healthcare facility for operation and maintenance. So this is something what can be replicated to other municipalities in Nepal as well. So we soon will be sharing this this model policy, sample policy that we call to the wider stakeholder like provincial and federal level, that we're planning to share this and advocate with the government to replicate in other municipalities. And besides that, we are working. We are also working with the municipality to have a kind of monitoring of operation and maintenance, where we'll have we'll be monitoring of the cost that is needed for operation and maintenance of these policies, the maintenance of wash infrastructure, and that will help government to allocate necessary resources. Last one is investment from the local government. So the government will also be allocating some of the resources from the, because we have actually very far government in Nepal is, I mean, they have some resources. Hopefully they will be allocating this, including climate to have climate resilient infrastructures. Thank you. Next one. So this is something, I mean, some recommendation that based on our learning, we need to have some supportive policies and guideline that will help us to have climate resilience infrastructure, capacity building of human resources, and developing regular maintenance of wash infrastructures, and emergency response plan. So I think that if we have that, most of the healthcare, they are lacking this. So if we have that, I think that will help us to deal with this issue. And regular monitoring of I mean, promote climate resilience in health programming. And definitely the last one is climate resilience building, wash facility and budget allocation things. So these are some of the recommendations based on our learning from Nepal. Thank you. Thank you very much.
Great. Thank you so much, Prakash Bahara from Terra Leone. And so now, again, a different perspective in terms of a different approach to climate resiliency or building climate resiliency in healthcare facilities, and the many, many learnings that have come from your work. And so now I want to turn over to some question and answer. And I see that there's been a lot of activity in the chat. So I do thank Comfort for going ahead and responding to some of the questions, but there's a few, and actually there's one of them I would like to also invite Prakash, if you would like to give comment on the question of time frame. So in Comfort's presentation, there was a comment made where just more time is needed for these programs regarding climate to be implemented and then evaluated properly. And so one question from Vashnia Tang was, What would be the suggestion if we implemented a one-year project on resilient wash and healthcare facilities and comfort? You're free also if you'd like to, I see you gave a written comment, if you'd like to elaborate more on the response that you gave, but I also want to see if Prakash has any thoughts about what happens when you're in a situation where the donor is providing a one-year time frame. What are the low-hanging fruit? What are the things that could be done, if anything? And then Comfort, I'd like to hear you speak more about sort of your perspective on the need to push for more time.
Thanks. I think that's a pretty good question. I mean, the most important thing that I see here is a guiding document, right? Time frame, I mean, 1 year is, I do not see a challenge actually. If you have proper guiding document and if you use WASFit, I think that your work is almost, I think 50% of your job is already done, right? So if we have that kind of documents, WASFit, that will give you the, I mean, the gap area. So if you have the guiding documents, so based on that, you can improve this your WAS infrastructure. So I do not see, I think for 1 year project, I see it's a good time to have at least some basic improvement. I mean, to make your WAS climate resilient WAS infrastructures. So, but the two key thing here we need to have is the basically the one guiding document, or you roll out WASP basically to do it.
Great, thank you so much, Prakash. Comfort, did you want to comment further?
Yes, thank you very much. So so our case, we were looking at mitigation and mitigating the impact of climate change. So it takes years to see these risks of climate change. So in 1 year, it's not possible to create mitigation measures and monitor them to see their impact. So if you have 1 year, depending on your budget, it's good to do climate resilient infrastructure that you'll win it, and then you work on working on the software and community awareness to see how we reverse some of these risks of climate change, the impact that we have. But then if normally the risk we see is a donor will give you money and tells you to implement a climate change mitigation and adaptation in a year. But then if it's software, like talking about climate change, raising awareness, some of those things are very doable. And just putting up infrastructure, those are doable. But to monitor and then confidently say that so how long does it take then for an aquifer to recharge? How long did it take for community to adapt climate resilient maybe approaches? Because some of these things require behavior change. And all of us agree to realize effective behavior change in 1 year, I think you need a miracle. So it depends, but for our case, 1 year didn't work for us, and that's why we had to ask for a budget neutral extension period.
Great, thank you so much, Comfort, and thank you for letting us know that you did push to ask for that extension. So again, more food for all of us to think about when we begin talking and negotiating with donors. So thank you so much for that. We have, again, a couple more questions coming in, but I want to make sure that we got to Carrie Ripke, who has a question for Prakash. Can you share more about how you have worked to promote funding for O&M for healthcare facilities?
This is interesting, actually. I mean, this was very interesting journey for us in Nepal, because the project, this project that we are implementing in Nepal is funded by a Swiss Development Corporation, which is now managed by the Swiss Water and Sanitation Consortium. So within that, there's a kind of dedicated kind of component on advocacy. So we managed to do some advocacy with the local government, showing that this is your status of your, WAS infrastructure in the healthcare facility, and how this is going to impact your population, right? So, what we need to understand is your one-time advocacy is not going to work, right? You need to have, several effort to make them convince the local government, elected local representative. So here, I think after our several kind of meeting and the different discussion with them and pictorial presentation, some of the case study sharing, they kind of agreed to have operation and maintenance policy for WASH in healthcare facility. And there is a, they agree to have some provision, kind of written provision for allocating some resources for healthcare facilities, right? So once policy is approved by the municipality, since they were very much kind of aware about the situation, so after endorsement of policy, they allocated resources to this healthcare facility, and they have also some municipal level fund to support WASH in healthcare facility that include climate resilient WASH infrastructures. So here, what I'm trying to highlight is your continuous advocacy or evidence-based advocacy with the local elected representative is key. There you need to be able to present the consequences of the WASH infrastructure, like poor WASH infrastructure to them. So I think that is your kind of very entry point, actually, that you have already, you manage, that will help you to allocate these kind of resources from the local government.
Mhm. Great, and thank you so much for that, Prakash. And we're going to pivot actually to a question that has kind of related to what you were just talking about in terms of government level systems planning. There's a question that came in earlier about how is district-wide systems strengthening approaches contributing to promote climate resilient WASH and healthcare facility works? Which are system building blocks that you focus on for promoting climate resilient WASH? I see Comfort, you've already provided a written comment. I don't know, Prakash, if you have some thoughts about this, or Comfort, if you'd like to say more. This is about systems strengthening approaches.
Yes, thank you. Like I'd written, so our interest actually in system strengthening was mostly for the purpose of leverage and being on the same page and having everyone know what to do, so that at the end of the day, if something fell on anyone's lap, they knew what to do. So for instance, for us in Pader, when you're going to do the implementation, we have forums that enable us to engage all the stakeholders that matter and build their capacity in the same way. And then monitor plans, monitor work plans, integration of work plans, and then sharing of plans. So this helps us a lot in making sure that everyone is on the same page, and then it becomes everyone's business. And it also helps a lot in leverage, integration, and avoiding resources going through the cracks, so that even the little resources you have, like for instance, I gave you the example where we used tractors. These tractors were not meant for that particular project, but we were given these tractors because then the planning became better with the district-wide system strengthening, planning improved, then alignment of resources got better, and then accountability became better. So it was very good for us. But the issue of which blocks, we did not set out to say that we are going to look at this particular block. We just did our work. But in the end, governance and leadership was, I think by now, if I'm to rate, I can rate governance and leadership as one key big block for me, because it helped us a lot. Having these people have the buy-in, especially, and leadership, not top leadership. In Achol, we have people that are called the Rotqueres. Having those people say it's okay, we can do this, was very beneficial for us.
Mm-hmm. Great, thank you so much, Comfort. Did I hear?
Prakash actually was
Prakash?
disconnected, and I don't
feel
know
like,
if he's
yeah,
able to get back on. He just texted me he's had power issues.
Okay. So actually, if we can stay with you, Comfort, for one other question that came in earlier, and we have some people who are curious about the answer regarding EcoSan. So this is from John Bergen, who's asking and really commenting on the use of EcoSan STEP in public institutions as a climate smart and safely managed sanitation option. The question was, how long have you been implementing EcoSan in healthcare facilities? And do you have any insights or documentation about supporting daily patients and or caregivers who may not be familiar with using the Ecosan toilet, whether it's the covering material, avoiding water in the vault. What has been your experience with this?
Thank you very much. First of all, the background is the reason why we opted for Ecosan in some healthcare facilities is because if we were to do the drainable, emptyable ones, where you have to empty the wet sludge, there were no disposal grounds for such. So for Pader, someone had to drive either to Gulu or these places don't make sense to you, but the cost of emptying was to become so high. So what we did, we opted not for the urine diversion Ecosan, but we opted for the combined, where urine and fecal matter are in the same chamber, but the type of Ecosan that we call for Sultana, where you have two chambers that are divided. When you use this chamber, you cover it up, use the alternative chamber. So there is no much science about making sure the vault is not blocked, but then the material that we use for covering is ash. And this has been very easy for us to use, and though we had issues of people wondering whether it was safe to put ash on fecal matter, which is something we had to manage those misconceptions. But there was also this thing, let me observe that people who use the ash will be okay. So the main type that we use is the Sultana because it's cheap and it allows for, it's easy for people to learn how to use it. And then the emptying, because of how it works, you are covered with ash. And then in some cases, we also integrated vermiculture, the material that we eventually empty when it's stored for a short period of time, it becomes safe for safe disposal, burial in safe ground, as opposed to the drainable latrines.
Great, thank you so much, Comfort, for this last question. And again, now watching our time, and I know there's some other comments in there. Please feel free to, Comfort, you've already been putting in some written thoughts. If you could respond to some of the chat questions or at least see some of the comments, that would be great. But we do want to transition to make sure that we have some time to hear from Steve Sara from Save the Children. So again, we thank both of our speakers from the case studies, Prakash and Comfort. And now moving over to Steve, who's going to share with us about the Green Climate Fund proposal that was developed by Save the Children, and just give us an overview of what's in it. And then we'll have a little bit of time to ask Steve some questions about this resource development for this kind of work. So over to you, Steve.
Thanks again, Joanne. As she mentioned, I'm Steve Sara. I'm a lead WASH advisor at Save the Children, and I've also been serving as the proposal director in a Save the Children-led effort to design a climate resilient WASH system strengthening project, which includes a large WASH and healthcare facility component in Lao PDR. And this project is meant to be funded by the Green Climate Fund. So I'm going to give a crash course in the Green Climate Fund, so that even if you're not interested in applying to the fund, or eligible, you still understand what the fund is doing in countries around the world. And then I'll also do a quick deep dive into the WASH healthcare facility portion of our proposal. Next slide, please. So real quickly, the Green Climate Fund has two unique roles of applying entities. The first is an accredited entity. These are pre-qualified partners who are able to apply to the fund to access money and lead proposal design and implementation of projects. So if you're consider them the prime implementing partners. They also have what's called nationally designated authorities, which are the government ministries or institutions that serve as the interface between the country government and the fund. The NDA is the clearinghouse or the approving authority of all Green Climate Fund activities in the country. So they're typically like the Ministry of Environment or Natural Resources or a similar ministry in each country. In some cases, the NDA ministry within a country can also be an accredited entity, so they can access the funding directly and they aren't required to use other partners to implement projects. So it just depends on the country and whether or not the NDA is also an accredited entity. Can you build the slide? Thank you. The Green Climate Fund has two broad programmatic areas. One is that they fund mitigation activities, which are designed to reduce the greenhouse gas emissions across the world and improve the capacity of carbon sinks. And the other type of program are adaptation activities, which is obviously to improve resilience to the impacts we've already been seeing due to climate change. And those adaptation activities are the ones I'm going to focus on. There are 4 types that you can see listed on the slide that are funded through the fund. And one interesting thing to note is that while the Green Climate Fund has many projects on ecosystems, resilient infrastructure, livelihoods, and food security, they have not yet funded any programs in health. So this project, if it's funded this year, will probably be the first funded health project from the Green Climate Fund. I also wanted to just briefly mention that the fund allows you to apply in various levels. So you can apply for programs that are less than 25 million, less than 50 million, or it goes even further beyond that. But each accredited partner or entity is accredited with a cap. So for Save the Children, for example, we're not allowed to apply for more than $50 million projects. Those accreditation levels also come with other stipulations. For instance, we aren't allowed under our accreditation status to do any large-scale infrastructure work. We can only do small infrastructure and rehabilitation work. And there are some nuances about the fund in that way. You can go to the GCF website, and it's actually a very transparent donor in many ways. So you can go on there and see everyone's approved proposals, the entire content of those proposals, and a lot of detail on the projects that they're funding around the world. They also have, you can go to the next slide. They have an intense focus on funding programs that are in least developed or small island states, especially for the adaptation components. And our proposal is a smaller funded proposal. It's called a simplified approval process proposal, which is capped at $25 million. And you can also add co-financing from other donors to bring up that number. So we've found $3 million of additional co-financing. So our program is actually going to be around $28 million. It's going to be a 5-year implementation period, and it will work across 25 highly vulnerable climate change districts in Lao PDR. We're working directly with 100 healthcare facilities. Most of them will also receive infrastructure work, and we're also working with 250 communities through the program. We're expected to start this program early next year in 2024. And I also wanted to mention that when you're designing a Green Climate Fund project, especially these simplified programs, they're meant to set the stage for scale. So if you apply for the simplified approval process, there's an understanding that there will be a window to apply for more money to scale the project nationally after the initial implementation period. And the design of these proposals can go on for quite a long time due to the GCF approval and design processes. So the typical timeline for designing one of these programs is about 3 years before you actually get the money. Next slide. So for our program in Lao, we are the prime partner along with the Ministry of Health. The Ministry of Natural Resources and Environment in Lao is the nationally designated authority. So they're the approving authority within the government. Our core partner on the program is WHO, and we're also getting technical assistance from Healthcare Without Harm for one of our subcomponents that's around mitigation of greenhouse gases from within the health system. Next slide. I only have 2 more slides, I think. You can start to build this one, or you can build it completely if you want to. There should be 4 outcomes. The program has 4 outcomes. I'm only going to focus intensively on outcome 3, which is where the WASH and healthcare facilities work lies. But I just wanted to mention that it's more comprehensive project than just the WASH component. Outcome 1 is focused on strengthening the higher levels of government capacity on climate resilience within the health system. And so we're focused with national level Ministry of Health partners as well as provincial level. On outcome 2, we're helping the government strengthen their surveillance and health information management systems to draw in better health and climate data to track, prepare for, and reduce climate-related disease burdens. Outcome 3 is about improving service delivery through supporting better infrastructure at the healthcare facility, but also building the capacity of the healthcare workforce. And outcome 4 is about building community capacity to become more resilient and to better respond for and prepare for climate and health related emergencies and seek care when appropriate. Next slide. I'm just going to focus on one output within our third outcome, which is the one that's hyper-focused on WASH and healthcare facilities. And before I go into the 5 activities that are under this output, I just wanted to mention that the UN Green Climate Fund they really scrutinize your proposal designs to make sure that everything that's being proposed is linked to a climate problem or a climate solution. So you can't just propose like general development issues to solve them with Green Climate Fund money. You have to justify that they're a direct link to the climate crisis. And so in Lao PDR with our program, we wouldn't have been able to include the WASH and healthcare facilities components without WHO having completed a national WASH fit assessment of the health facilities across the country. They actually did the assessment in, I think, all 1,200 plus health facilities within the country, and they included the new climate questions in that assessment, which gave us the data we needed to justify including this work to the Green Climate Fund. So that was like a critical precursor to the project. So this outcome includes 5 activities. One is that we're working with Healthcare Without Harm's GHG emissions tool to assess the extent to which the health system in Laos is emitting greenhouse gases, and that will inform our approach to infrastructure improvements within the facility. The next activity, if you want to build this slide, I think there's a total of 5 activities. The next one is about making healthcare facility infrastructure improvements to just the general shell of the health facilities to be more resilient to flood, drought, and extreme heat. The third activity is around strengthening electrical services to be more consistently reliable and more energy efficient and climate resilient. The fourth activity is about upgrading the WASH services within climate vulnerable healthcare facilities so that the WASH services are reliable and also resilient to flood and drought. And then the fifth activity is about strengthening the capacity of the Ministry of Health, NAMSAAT, which is the WASH department under the Ministry of Health, and the private sector partners engaged in this work to more effectively operate, maintain, and monitor health facility infrastructure moving forward. So that was a very brief overview of our project and the donor, but I'm open to any questions if there are any. And you can also contact me after the webinar. I'm happy to talk more about GCF as a donor and also our planned work in Lao PDR. Thanks.
Great, thank you so much, Steve. Like, this is really helpful. We don't get very many opportunities to hear from folks who are working on such large proposals. And thank you and Save the Children. And as you described, GCF for just the transparency to allow us to see as these proposals are being formed, the ideas, the concepts, and having them just plainly on the website. That's so very helpful. And again, we thank you for going into detail regarding your work in your particular project. So you mentioned a couple of things, and I know we may have 1 or 2 questions in the chat. But I wanted to ask if you could just elaborate and think more. I think I heard, at least from that last slide, one of the really important pieces was having that wash fit assessment lay the groundwork and be that justification to anchor whatever your approach was going to be, whatever it is that you were going to propose in terms of interventions. That was a really important ingredient, if you will, in terms of getting you to this stage of this proposal process. Do you have any other ingredients, if you will, that you thought were really strong and helped move the proposal beyond that concept stage that has been approved and now you're into this further review?
Yeah, I think the first thing is that WHO and the Ministry of Health actually came up with the idea for the program several years ago, and they weren't accredited, so they couldn't access GCF money directly, but they brought the idea to Save the Children and asked us to become involved and lead the proposal so they could access the funding. Mm-hmm. So having that that ministry support and actual suggestion from the ministry to start working on this problem was beneficial because there was immediate buy-in from the get-go from all levels of the government. And another thing that's interesting about the Green Climate Fund, and one of the reasons why the proposal design process takes so long, is they require a pretty lengthy assessments and stakeholder engagement activities throughout the proposal design, so that communities, government ministries at different levels, anyone who's involved in the project in any way has a chance to look at the design and feed into the activities, which I think it was a very interesting process for us to go through and resulted in a lot of changes to the original idea.
Again, Steve, thank you. This has just been so very helpful to us. And I know that you mentioned that folks could contact you if they have specific questions. If you don't mind providing your contact info in the chat, that would be so very helpful to us. And now, because we're almost like 1 minute shy of ending our session, I'm going to thank you, Steve, for your presentation, and Save the Children for, again, sharing and being so very open with us. And I'm going to transition quickly to Haley, who is going to close out for us. Over to you, Haley.
Great, thanks so much, Lindsay. Joanne. Well, first of all, I just would like to again thank all of the speakers today for sharing just all of the learnings that you have. It was a really rich discussion. And yeah, looking forward to hearing more work. Just to close us out here, so just some ways to get involved and some next steps here. So we do have a listserv for those of you who are aware of our Washington Healthcare Facility COP website. You can see a lot of the information there, but there's also an option to join the listserv on that website. I also just put the link in the chat. If you sign up for this listserv, you basically just receive updates on future COP events, resources that come out. We do share a monthly newsletter, so subscribing to that kind of gives you access to all of that information. And then next, we're always looking for topics for future COP events. This COP has been running for quite some time, and we're always looking to find just more information or things that you're interested in learning about. We've covered a lot of topics, but if you have an idea for maybe a topic that hasn't been discussed or something that you're doing, we would love to hear that. Similarly, we do send out, this monthly newsletter, and at every event we do start the session with a success story. So if you have one that you want to share, you can feel free to email us or let us know. Lindsay just put our email in the chat. It's wnhcfaction@emory.edu. So feel free to let us know that. And then just lastly here, we will be having a next session in July. This session will be an Ask the Experts or Ask an Expert session with various kind of topical experts. So if this is a time where, you maybe not have a lot of familiarity with experts, or you have questions that you don't really know how to ask or who to ask, this would be a great time to bring those questions to this session. We're hoping that it will be either on healthcare waste management, IPC, and gender. So the details of that session will be coming out shortly, probably in the next newsletter. But with that, I will close and just say too that the recording for this session in both English, Spanish, and French will be posted to our website here, which Lindsay is showing. So there'll be kind of a new tab with that information with the recordings posted. So thanks everyone for joining. Really appreciate everyone today, and thanks to everyone, and we'll see you all again in July.
Thanks, everyone. Thank you, Haley.
Yep.
Have a
Thank
great rest
you.
of your days.
Thank you to our speakers and our interpreters. We so appreciate you all. Have a great rest of your day.
Take care all.